We'll get started.
Okay.
Good morning. This is the called meeting of the Medical Advisory Committee. Is now in session. The time is 9:01, Sunday, September the 12th, 2021. This meeting is being held via teleconference and live stream. Will the meeting please come to order? At this time, I certify our quorum is present. I'm Dr. Jesse DeLee from San Antonio, Texas. I've been appointed to chair this committee. Will the committee members and UIL staff please introduce themselves? Arnie, you
Okay, I'll
want to
start. Hondo Schneider, athletic trainer, Midland, Texas.
I'm Arnie Fenrich, pediatric electrophysiologist, Austin, Texas.
Kerry Tanamachi, MD, orthopedic surgeon, Mesquite, Texas.
Valerie Duran, athletic trainer, North Crowley High School, Fort Worth, Texas.
I think I was Marion Hendricks, family practice, Corpus Christi.
Al?
Al Hergenroder, Baylor College of Medicine, Texas Children's Hospital, Pediatrics, Adolescent Medicine, and Sports Medicine.
I think that's the members. UIL staff?
Coach Tipton, if you would introduce yourself, you were on mute.
Sam Tipton, Executive Director, Texas Girls Coaches Association. Did you get that?
Yes, sir. Dr. Puig has joined us.
John?
I'm Jamie Harrison with UIL.
Susan Elza, UIL staff.
Mark Cousins, UIL staff.
Jessica Walker, UIL staff.
Kelsey Wycliffe, UIL staff.
All right. Unless there's an objection, meeting will be held in accordance with the 2021-22 UIL Constitution and Contest Rules and the Roberts Rules of Orders. Hearing no objections, so ordered. If there's no objection, the business meeting and public hearing shall be as in the printed agenda. I reserve the right to deviate from the order if it's necessary. Hearing no objections, so ordered. The members of the committee have been provided with revised and edited minutes from our September of last year meeting. Are there any corrections or revisions to these minutes? If not, I will entertain a motion to approve them.
Hey, I had a question which may be addressed later on when we start talking about this. It's just on the written proposals from the public under F, that last paragraph. Is that last sentence missing a word toward the end? So when we were talking about the return to play after COVID diagnosis, the last sentence seems like it's missing a word, but we could fix that or clarify that once we get into the discussion, I think, here a little bit later.
Okay, we'll do that. Any other minutes corrections? If not, the minutes are adopted.
I'm sorry, I was on mute. Mark, how does it read right now that you feel like the sentence needs to be finished?
Not sure how it's supposed to be finished. It says that when getting a doctor's clearance to return to participation after a COVID positive test is only required for those students who a physical to participate. So it seems like there is a word missing somewhere in there. I'm just not sure what that word is supposed to be, or whether what we do here in a minute to address that will fix any of those concerns. It just seems like a word is missing from that sentence.
I think it's require a physical.
Yeah.
If I'm
I
looking
think you are correct.
at my notes, it's just the word require.
Yeah, that needs to be edited and then accepted.
I hear a second.
I second.
Second.
All a favor?
Aye.
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 Anybody opposed? Okay. The purpose of our committee is to examine the health and safety of students involved in interscholastic activity participation. It's the goal of this committee to work cooperative with the UIL standing committees and the Legislative Council to address sports medicine issues as they impact the rules and health and safety of participants. The committee should also work with other medical and paramedical organizations that can assist us with our efforts. Finally, the committee should develop position statements and guidelines to assist the UIL membership in making informed decisions concerning sports medicine issues. Any recommendations from this committee are to be presented to the UIL Legislative Council Athletic Committee. The committee will now begin its business meeting. Are there any items the committee or staff would like to bring forward under new business?
Mr. Chair, we can start with item F.
All right.
Having heard nothing from the, nothing else from the membership. Item F on the agenda, we have a written proposal that's in your packet. Jess, I don't know if you're going to share your screen to show it or not. It's a proposal to change the wording related to the return to play protocol for managing concussions. Jessica is going to show you that right there on your screen. Mark, you can help me with this. But as I recall, any wording that we have comes from the law now, and would be difficult to clear. There may be some that's not from the law. What's your recollection on this one?
Well, this, I mean, if I recall, and Jess, if you can, I don't know if you can slide down to the concussion acknowledgement form. It seems to me he was referencing this language from the concussion acknowledgement form, which is signed before the kids participate. And it's under that section on, go down to treatment of concussion.
Right.
Go back up. Under treatment of concussion is where he talks about, where we talk about this, that last sentence, when all signs and symptoms. I'm not sure that this in any way would hinder the ability of the local school district medical personnel. It seems like he was saying that this somehow limited the local health practitioner, whether it be the athletic trainer or school nurse or whoever, from being able to help that student get cleared. I'm not at all sure that that's what that does. And again, this is the form they signed prior to participation and really has nothing to do with the return to play. I'd have to go back and look at our return to play form to see whether or not that even is covered under the actual return to play form. And even then, our return to play form is not a required form, it is a recommended form.
So what is the proposal we're being asked to consider? Can somebody state that?
Jess, if you can go back to it. That way we don't misquote it.
Yeah, the return to play form doesn't indicate anything about what he is referring to. And I'm not really sure what the proposal is. It just seems like it was a concern that what our language was on that acknowledgement form somehow limited the ability of a local trainer or school physician or nurse to be able to begin that return to play protocol, which is not the way I read that.
Yeah, as I'm reading over this proposal, starting sort of midway with the sentence, I would urge you to consider modifying this or any document that puts needed medical resources in the position to be unable to help when there is a need. I don't understand that sentence.
Me either. That's why that's why I can't answer your question directly, to be very honest. I don't understand what this is requesting.
I totally agree. I don't see a proposal written within this anywhere.
go back and respond to his email and let him know that there's nothing in there? I mean, I would assume that this language, I mean, generally you would not want a student to begin the return to play protocol until the signs and symptoms have subsided and cleared. Unless there's some different feeling, I don't see that there would be any action needed from our part on this.
I would agree.
Yeah, it seems as though they're wanting the local return to play protocol to engage before those symptoms have cleared, but it's pretty unclear what they're asking to me.
Anybody else?
No, I agree. I'm not sure that there's any reason to or need to change anything. And I don't think he's asking something that really has any basis.
I would also concur.
His last sentence on page 1 says, I would like to discussing this with you further. Should we have a member of the committee contact him?
I think responding by email, asking
Okay.
him to clarify this
That's
and give us a
perfect.
specific proposal is what I would suggest.
Let's do that.
Staff will take care of that.
Okay, any other comments? All right,
Next, Mr. Chair, we have the updated pre-participation physical requirements. And I think there are some questions on this. So Jess, if there's something to share on your screen, please do that. And otherwise would open it up to any comments. Dr. Hergenroder, I think you had some on this.
Well, in reviewing the form that's been approved by the AAFP, AAP, American College of Sports Medicine, AMSSM, the form that they suggest includes the 4 screening questions from the PHQ-4, which have to do with mental health issues. And yeah, let's go to the drop down a little bit. Go to the PHQ-4 first. I'm sorry, go back up.
oh, that's it.
It's up a little bit higher. Oh, there's the PHQ-4. So first of all, this came out in 2019. I thought this was a bad idea in 2019 because in going back to the original opening statement of the purpose of this committee, I believe it says having to do with the health and welfare or something like that, Dr. DeLee,
Yes.
in the context of participation in sports. So there's always been this tension between what is the pre-participation exam? Is it clearance for sports or is it a global sort of health evaluation? And this starts to tip over into the morbidities and mortalities of adolescents, depression, mental health issues, et cetera. And now with COVID, if you ask this question to a cross-section of athletes, feeling nervous, not being able to stop worrying, there's going to be a massive bump in the number of teenagers who are going to answer this positive. And the point is, if you're going to screen for something and there's a positive, you need to do something about it. And our mental health system is so taxed for adolescents. Our waiting list right now on adolescent medicine is 4 months to see a new psychologist, 4 months. So I would not include this in the Texas pre-participation exam form. I have some questions about COVID later, but these are my comments about including the PHQ-4.
Anybody else? I think, again, as Al points out, we have constantly tried to walk that line between providing global health care and clearing patients for safely participating in sports. And I think this is one of those things that gets into global health care, which is not our charge. Somebody was fixing to speak?
Yeah, Jesse, it's me, Arnie. Are we being asked to revise our form and include this information on the PHQ4, or is it just there for us to review and comment on?
Jess, can you go to the top of that form and let us see what that is? I think this was something in a packet Mark received from the SMAC that's just part of recommendations.
Yeah, this was information that was shared from the National Federation of Sports Medicine Advisory Committee. It was actually part of a larger packet of information in reference to their updated recommendations in reference to the cardiac issues that come along with some of the originally concerned about cardiac issues about kids recovering from COVID-19, as well as just some other information about helping kids go back to school safely from the federal government. So it was just more of an informational piece, not necessarily a request to consider. I mean, obviously we can consider if we feel like it's appropriate, but it was not any type of proposal or information that the Federation felt like we should act on. It was just information they were sharing.
Okay. Any other comments? Okay, next issue, Jamie.
Oh, wait, hold up. The other part of this form, that's this background form, has to do with COVID.
Yeah.
Can you go down to the COVID question, please? Right. Have you had COVID? Have you been immunized for COVID? When this form was developed, that was important. But now with waning, first of all, if somebody says no, have you been immunized for COVID-19? If they check no, that it doesn't preclude them from sports, first of all. Second of all is with the Delta variant right now, being immunized doesn't protect, it protects you from getting put in the hospital and having adverse outcomes, but it doesn't protect you from getting infected. So have you been immunized? I don't think that's relevant. And have you had COVID? I guess that might be important. And who's ever doing this clearance needs to be able to know that they've had COVID, and they need to say, you know, something like they have no sequelae of COVID, not clear them. But immunization for COVID, I don't think should be on the preseason exam form at this point. Again, I don't know that we're being asked to do that, but since this is background, that was my response to that.
Yes, sir. And to be clear, when we get later in the agenda to the medical forms, that's when we'll review the actual UIL pre-participation physical form. This one's just for background, but all right. Good points though.
Anybody else? Okay.
Welcome to Dr. Chasse and to Spanky. I think we missed you during the introductions, but you've now joined us, so welcome.
Thank you.
Next is Dr. DeLee and I have spoken about this a few times lately. The number one question that I'm receiving, and a question that many of our staff are receiving as well, but for me, it is the number one topic that I'm getting questions over, and it's ahead of second place by a wide margin, is the physician's clearance post-COVID. So to give you some background, this is not new. This is something that the Medical Advisory Committee recommended we put in place, and we did put in place way back at the beginning of last school year. For some reason, some people in the school business are just now seeing it or are reading it differently. The wording hasn't changed from day one. It has been the exact same. But for some reason, they're reading it differently now. And it's caused a great deal of consternation for a variety of reasons. One is, comments about students from low socioeconomic backgrounds and not having access to healthcare. Another is just the strain on the healthcare system in general and the ability, getting an appointment to see a physician at all, and even some reports of physicians refusing to see these patients for this reason because they don't feel like they know enough about COVID as an individual physician to make these determinations. All of this also leads to who can conduct that. Now, the committee has discussed this a good bit. Staff has been able to respond appropriately to those questions that, for example, a nurse practitioner, and I'm going to use words that may be wrong. So I'm using regular people words here. So if I get them wrong, know in advance that I'm just talking plainly. Essentially, a nurse practitioner works under the supervision, some sort of articulated agreement with a licensed physician. And so if the physician has delegated the authority to that nurse practitioner to conduct the evaluation, that has been okay. I had a great conversation with a representative from the Nurse Practitioners Association in Texas, and I don't recall the name of it, but that's what it is, who said that this is an issue that they run into regularly, and they have asked that we consider amending the language very slightly, and instead of just saying cleared by a physician, say cleared by a physician or appropriate delegate or authorized delegate, something like that, clarifying that it doesn't just have to be the physician that conducts the evaluation, but the physician can delegate that authority to a physician's assistant or a nurse practitioner. So I think that we could have some good discussion about this requirement and what to do with it generally, but there is that specific request that we consider adjusting the language to some degree, clearly indicating in rule that the physician can delegate authority to conduct that evaluation to an appropriate extended care sort of practitioner.
How does it read right now, Jamie?
Jess, if you'll pull that up, I think it simply says that a student who has been diagnosed with COVID must be cleared by a physician before returning to participation. And that applies to students in athletics or marching band. Essentially, that goes back to the clarification in the minutes earlier. It applies to any activities for which a pre-participation physical is required. So that's all athletics and marching band.
And so the Nurse Practitioner Association is asking for an amendment to say physician or her or his delegate. Is that what the request is?
Yes, authorized delegate, I think, is the appropriate terminology.
What about chiropractors, Jamie?
That's a question for you guys. I don't know if a physician, can a physician delegate that to a chiropractor?
No.
Well, I want to throw something out there. Years ago, we had the chiropractic issue with athletic pre-participation physicals, and they're allowed to sign off on physicals. So if we exclude them from clearance on COVID and allow nurse practitioners and PAs, that's something we need to think about.
I think that's why the request is not to list who can do it. We can still say it has to be a physician or a physician's delegate so that the physician is still making the decision to delegate.
What if we use the term medical provider? That includes nurse practitioners and physicians assistants. Instead of physician.
But that would also include a chiropractor as well.
Do you know that for sure?
Yeah.
You know what? I would go with the language that Jamie just recommended, which is physician or I can't remember exactly your phrase, Jamie, but was it delegate or somebody delegated by the physician?
Yeah, physician or authorized physician's delegate.
Yeah, that's what I would go with.
I would agree with that as well.
Agreed.
Now, Hondo, you are 100% correct. I would bet you dollars to donuts at the next medical advisory committee meeting, we'll be reconsidering this issue with some additional requests. You are not wrong. But I do think that's maybe the most, if you guys agree, I think that's maybe the most appropriate way to go at the moment.
What language are you using?
Must be cleared by a physician or authorized physician's delegate.
The other thing that addresses, Jamie, is there were some comments from your constituents about issues about infrastructure and strain on the healthcare system and low socioeconomic, et cetera. A lot of those things are systems issues. And what this language does is increases the pool of providers who could potentially clear somebody post-COVID. So it actually addresses some of the issues that you brought up in your preamble.
Yes, sir.
Now, the concern is with physicians delegate as the wording, does that mean that the physician can delegate one of his nurses to do it?
I'm going to assume that's addressed in scope of practice law, but that could be an incorrect assumption.
Well, if she or he does, and they're outside of their scope of practice, they've got a problem.
Yeah, absolutely agree.
Okay.
Would it be clear to say physician or his or her legal authorized delegate?
I would stick with the original language.
How-
I mean,
how
the
would-
language that Jamie suggested. I think it gives enough clarity, but also I like it the way it was proposed by Jamie.
Or do you want to say physician or physician's delegated medical provider?
I still like Jamie's original language.
Okay.
Well, let's vote on Jamie's language versus Arnie's.
So Jamie, I need you to restate what we're voting on.
I'm going to give you two options. We would be amending the language to say cleared by a physician, or one option, physician's authorized delegate, or authorized physician's delegate. I don't know that there's a big difference in that, but one might be a little more clear than the other.
I think Arnie's substituted medical provider for delegate.
Yeah. I think we got to stay away from that medical provider business.
I agree.
It just
I agree with you.
It just removes the language that might mean that they can have a nurse, or they could even have an MA in their office clearing somebody. Is the only concern I have. I mean, we use a lot of MAs in our office and they answer phone calls. So that's my.
But they answer, Arnie, I'm sure they answer phone calls under some sort of guidance and protocols. They're not clearing COVID patients.
I guarantee the physicians aren't delegating them to do that.
Nope.
They better not be.
No.
And there has to be some kind of written clearance. It's not a verbal clearance.
So we need to vote.
Let's vote on Jamie's. And if there's any question, we'll vote on the other one too. Jamie, read yours.
Cleared by a physician or physician's authorized delegate.
All in favor, say aye.
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 All opposed? Okay, no need for a second vote. All right, next, Jamie.
Next on the agenda is COVID-19 vaccine. And again, Jess, if you have anything to share on your screen, please do so. I will share with the committee that the Commissioner of Education and the Texas Education Agency has been working closely with the governor's office to create informational products that the agency can share with school districts, and school districts can choose to use them or not. So these are, I would probably stop short of calling them promotional materials, but certainly informational materials about the vaccine, so that any student whose parents want them to have the vaccine have the information necessary to help encourage them to get the vaccine. Access to it, information about the vaccine itself, that sort of thing. They have asked UIL, and then UIL in turn asked THSCA. And we'll visit with the other coaches associations as well to consider using their communication channels to help share information with coaches. So we'll hit coaches, athletic directors, and school superintendents, all surrounding specifically extracurricular activities. So the agency's creating all of the informational products themselves, but they are tailored specifically for sports, specifically for marching band, that sort of thing, that schools can easily insert their own logo, put their school colors on them, and use them to distribute to school constituents, specifically parents and students, if they choose to do so. So the fact that we were asked to do that, I thought it was important with the committee meeting today that we at least share that with you and see if there's any feedback the committee or warnings the committee would like to offer related to that.
Okay, my question, I guess, is going to be this: is we don't have to have a vote on whether to disseminate public information, do we?
No, this is not an action item. This is just us sharing information with you and giving you an opportunity to provide feedback.
I don't think there's any problem with disseminating information as long as it's all factual and it's got scientific data to back it up.
So are we being asked to, we're not being asked to review content, right? This is just an FYI, Jamie?
Yes, sir. The content is being created between the Texas Education Agency and the Department of State Health Services. So that, these aren't private groups creating any sort of informational, campaign. This is an informational campaign done by state agencies. So you can imagine that, there's a pretty thorough vetting process that goes along with that.
Sounds like we've been informed.
Perfect. Next on the list is a concussion information and update. You have a report that I think you just got this morning. So timing wasn't great for that. Monroe Cullum with UT Southwestern is otherwise committed today and is not able to join us, but they did share a report with us. I would rather imagine that you have not had time to review it and develop any questions. If you have, we're happy to hear them. If not, we're happy to receive them from you. You can call us with those concerns or email them to us directly, and we'll sort through it with UT Southwestern.
So my response is that if they want us to read it, they need to get it to us in a timely fashion.
Yes, sir. That message has been delivered and will be delivered again, I assure you. There was also a study or project conducted in Michigan that a couple of you have reached out to me about, 2-3 months ago. Mark has done some research on that for us. Mark, if you want to give us a brief report on what you've learned and what our next steps might be with that.
Yeah, I think this was something maybe Dr. Hergenroder or somebody may have sent across in reference to some information coming out from the state of Michigan. They actually began back in the 2015-16 school year. They passed a rule that required their schools to report all head injuries sustained during their sponsored activities and report them through an online reporting system. They set up an online system to do it. So they've been gathering that information now for the last, I guess it's 15-16. The one thing they did express concerns about, at least for the 19-20 data that they're looking at now, is that their spring seasons were interrupted, like a lot of people's were, in reference to some of the outcomes and being able to get that information. But I think one of the things that they've seen is they've been pretty consistent in reference to their head injuries. Even some of the changes that they made to their contact limitations and those kind of things in their contact sports, I think what they're running into is the issue is they made those changes right about the same time that they started gathering the data. So they really didn't have the original baseline information to see the difference that their rule changes may have created. But what they've been able to see, at least over the few years, is I think what a lot of people would think is going to be the case. Their top 10 head injury sports per 1,000 participants. Obviously, football is up there at the top. Ice hockey, wrestling, girls basketball, and cheer are around the top 5. Approximately 2/3 of their reported concussions occur in competition rather than practice. The only exception to that was their spirit competition, where over 80% of the head injuries actually occurred in practice rather than competition. So, I mean, it is something that they have required all of their schools to report all of their head injuries through this online system. They've got it set up so it can be done by an athletic trainer, a school administrator, or a coach. And they actually have people on their staff that go through those and follow up to make sure that that information is looked at and reported. And then they actually have people on their staff that crunch the numbers and put out that report. We can certainly share that report with y'all if that's something you're interested in. We can get that information and send that out. But that's the report I got back from their executive director when I finally had a chance to catch up with them.
So one of the questions I had in reading that report was, what is the infrastructure for that statewide system? How many FTEs? How many students do they serve? How many school districts do they serve? And what's the cost of that program?
I don't know if they've got that specific. I can go back through and reach that. I mean, their association has, I think, around 700 high schools. Jamie, I might be a little bit high on that, but they are a relatively large association. I think one of the more interesting things about them, too, in reference to this, is they were one of the last associations to actually create a medical advisory committee. Their medical advisory committee, I think, only came online within the last couple of years. They had traditionally used the sports medicine advisory committee from Federation to do most of their stuff. So I find it interesting that they were actually gathering this data that far back when they didn't necessarily have a committee to recommend that. But I can do a little digging and find out a little bit more about the size and number of students. But I think they're around 700 to 800 high schools. And they only did that with grades 9 through 12. They didn't do any data gathering from junior high students or middle school students.
How many high schools do we have in Texas?
Between 14 and 1,500 in UIL.
Yeah, they have, I'm just at the start of the 2019-20 school year, they had 753 high schools with various enrollments and resources. And I'm trying to see, he doesn't put in information about how many actual students they cover, but it's 753 high schools.
So I think, you guys correct me if I'm wrong, please. I think this is what we're hoping the context study could become for Texas. It just hasn't become that as quickly as we had hoped. Is that accurate?
That's a complicated question, Jamie.
Yes, sir.
What I take from this data is that it reinforces the epidemiology of concussion in high school sports. There's nothing in this report that would change. I'll speak for myself. There's nothing in this report that would change my practice or the advice I would give to a local high school in terms of, all the things that coaches, docs, trainers are supposed to be doing, et cetera. So I think it's a nice background piece to have, but what's happening in Michigan, other than they're playing a lot more ice hockey than we are, doesn't seem all that much different from what's happening in Texas.
Yes, sir.
I got through reading this report from context a little bit. I've been browsing it while we've been talking, and 1/3 of their reported incidents come from outside UAL activities, if anybody wants to know that.
Well,
Hondo, I think that's important for us.
Yeah, that didn't surprise me.
Yeah, and Hondo, to follow up on that, in the larger MTBI, mild TBI data in pediatrics and adolescents is, if I'm not mistaken, 60% of concussions in children and adolescents come from activities outside of sports.
And I want to play the devil's advocate here, which y'all know I do very well. I got to throw this out there. We're collecting this data, and we've been collecting it for years now. Are we got, when we get this data disseminated to us, where's it going to take us on the next step? Because we haven't really talked about that.
Great question, Hondo. No, great. I'm trying to figure out what's going to be actionable on our side.
So the UT Southwestern folks aren't on the call. I'll do my best to represent my understanding with my limited brain of how they might respond to that. What they would like to see is a more comprehensive reporting requirement from us so that they have what they would call a more comprehensive data set. And I think what has happened with all of this is that we started with, we don't know what we don't know, right? We've got to get some data so that we can figure out what we don't know. And then that data might help drive policy decisions moving forward. So I think that's the point of the data, is to see if we need to make rules changes or other policy changes that might make our activities safer. The rub between us, this group collectively, the Medical Advisory Committee and UIL, and the researchers at UT Southwestern has been that the data reporting requirement. They want this group to recommend to the UIL Legislative Council that all schools report through this instead of just those in the largest conference. And by getting a more complete data set, we will find out what value the data set has and whether or not it will be able to inform policy decisions. And because of some structural concerns and reporting concerns that you guys have received back, and now I'm summarizing your thoughts, probably in a very poor and articulate way. You haven't been willing to take that step to say everybody has to report to this system, because this system isn't what we need it to be to give us a data set that will help inform policy decisions. And so we've been in this sort of purgatory now for 2 or 3 years. Some of that delayed, quite frankly, because of the virus and all of our attention's being focused away from it for a bit. But we've been in this purgatory of, we probably need a data set to help drive decisions. The question is whether or not the context system is it. And context has said, this is the right system. We just need you to put a reporting requirement in place so that we have a complete data set. And we haven't been able to resolve that. Anyone who would like to correct anything I've said, I promise you I won't be offended.
I'm not going to correct you, Jamie. I'm just going to throw this also out there, is that granted, I think the more data we can have, the more it would lead us to making appropriate decisions and policy recommendations for contact and, or, cheer sport spirit, things like that. But I think the biggest problem that we're going to run into at the lower levels is the data that we retrieve from them is going to be skewed to a level that I don't think would be scientifically proven to be evident. Because we're getting that data from people who are not data-driven, scientific-based people. Except for saying, okay, Joe Blow had a concussion, that doesn't give us all the detail we need. And when you're talking about 6-man football and 2A and 3A schools, that data that we're retrieving from them, the reliability of it, I think, is going to be skeptical. Correct me, somebody, if I'm wrong, but I just can't see it all being. I think we're getting in a world that we don't know where we're going when we start deriving data from all the way from top to bottom.
I think this is a far simpler issue than we're making. We entered this agreement as a marriage, and each person, each group had a responsibility. We're needed by them to access to rules changes. And we agreed to do that based on the data as it comes about. Now, we got their report this morning. We, as Jamie says, we may be negligent in that COVID has interfered with some of what we do. it obviously has interfered with what they do, or we would have had this report 2 or 3 weeks ago. I don't think we're off track. I think when we see the data, then we decide and go into the details that Hondo's talking about. But we need to have a more diligent marriage partner in this deal than we've had.
I have a question. So I obviously, from the people in this group, am one that actually has to report. The
Yes.
only thing that I am reporting is this person had a concussion on this day. And like the questions that were asked is only, were they wearing protective equipment? Like, do they have a helmet or whatever? That's it. I'm not understanding on the back end what me telling you how many of my kids got a concussion, if they were male or female, what sport, and whether they were wearing protective equipment makes rule policies later. How do you see what I'm saying?
Yes.
It's not like we're talking about how many days it was returned to play, when I started, some moderate physical activity, whether or not we introduced vitamins or any stuff like that, that could then at the back end say, we've seen now that this helps or hurts or doesn't do anything. I mean, what I'm actually reporting, I don't understand on the back end actually, other than on, again, even if we had a zillion people reporting, we're going to still come to find out that football has the highest and girls soccer has the highest, which we always have. So I'm not understanding on the back end, even if we had so many people reporting, what good we're getting other than just more information and confirmation of what we've already known.
Well stated.
Yeah, I mean, Valerie's the end user of this data set. It's pre-COVID, we had questions about methodology. So yes, COVID's impacted this process, but we've had these same questions since the beginning, Valerie.
Mm-hmm.
Well, they want us to recommend universal reporting. We cannot do that until we have read this report and discussed it as a committee. So we will do the bureaucratic thing and reconsider it in the spring.
Can we request that we see a copy of what the actual questions are? If there's only 2 questions, when did they get concussed and were they wearing headgear? That seems limited. Is that all the questions that they're really asking?
I believe there's more questions than that, but I can definitely get you a list of those questions. And Mr. Chair, if it's okay, once we get those responses, we've done this before. There are members of this committee who serve on, I forget the name of it, the research committee, I believe, a research team for that particular study. I'll see if I can organize a time that works for our committee members to meet directly with the researchers at UT Southwestern so that we can sort through some of this and maybe get off a high center.
So I would add to what's been said so far. Would it be okay if Valerie sends around what she has as her working data form, and that we also request what's coming from the investigators, just to make sure that those two are the same collection form?
Yeah, so my school district uses rank 1. So those are the questions that I'm asked. Is this a concussion? Yes. And it's like dates. And then I give age. I give were they wearing protective equipment, and that's it. I mean, that's the only thing that we get on my end. But again, I'm using an EMR system as opposed to, I don't know how everybody else enters their stuff.
Well, I think that's part of the problem is that the delivery system of the data, it's always been something the committee has discussed. Collection and delivery of data has always been discussed here.
I think the whole committee needs to see the form that is being sent out on this study under our guides.
Yes, sir. So Valerie, if you will send that to Jessica, she
Okay.
will make sure the entire committee gets it, and I will make sure Monroe sends their version, and the committee will get both at the same time to compare.
Perfect.
Yeah.
Okay, next.
Is there any type of cardiac update? Arnie? Dr. Fenrich, excuse me.
Well, I guess one question I wanted to bring up are we, have we completed discussion about the return to play after COVID? Because I know that included in our packet were the forms from the National Federation of State High School Associations that included in that was a sort of guidelines for return to play after, whether you had mild or asymptomatic COVID, whether you had symptomatic COVID. And I think we've talked before that we aren't in the business of clearing kids to play sports after COVID, and that should be their physician or their physician's delegate. I think that one of the things that I wanted to bring up, because the main concern is those that may have had a myocarditis type picture, and when can they return to play? And I know that some school districts, and in fact, I have a 3-page amount of information from the Elgin School District, and they are implementing a graduated return to play where they are implementing a graduated return to play. Sorry. Sorry, I just had to move the cat.
Live TV is always entertaining, Arnie.
Right. They had to implement a graduated return, or they are implementing a graduated return to play. I don't know if you've seen that, Jamie, but my question is, are individual school districts able to do and manage this the way they want to? Because this is, I know that we've had families that we've seen kids in the office and their parents are wondering, how are we able to do this? I don't know if you've seen the graduated return to play form that has been put out by the AAP, but I don't think that the schools should be getting into enforcing a graduated return to play. I think that should be the physician or physician delegate that does that. Any comments?
Yeah, my response, we'll start by saying this is a complex topic. And you get into what authority a local governmental agency, in this instance an ISD, has, and what authority we have to limit their authority. The way our rules have worked traditionally for a long, long time, and Mark and Susan, you guys have a different opinion, please speak out, is we set the minimum you have to meet, but they can always be more strict. I mean, that happens with grading policies, that happens with game limitations, practice limitations. Schools, they have to meet at least our standard, but can go beyond that if they want. They just can't remove any of our standards or not meet any of those standards. So I guess I don't know enough about this graduated return to play to have a real informed decision, other than I would have some concern with UIL stepping in and saying to a school district, you're doing something that's going above and beyond what we're doing that you believe is necessary to keep your kids safe, and we're going to tell you you cannot do that. But again, I don't know enough about this particular graduated return to play protocol that you're discussing to give a really informed response.
Is there some place on the website that all this information that was sent to us from the National Federation, there's a link to it that people can access it?
Mark, what have we put up so far?
No, we haven't posted any of the information from the Federation to our site. We shared it with you just, again, as informational stuff. We have not posted this on our website or released it widely. We mostly take that information in, let you guys see it. And if it's something you feel like we should share more widely, we do. But generally, we share this information with the Medical Advisory Committee, and we don't necessarily put it online or share it widely unless it's something y'all recommend that we do. So this has not been posted on our website.
It seems to me that physicians and their delegates should be following the guidelines of their professional organizational body, whether it's AAFP, AAP, American Medical Society for Sports Medicine. I don't think we should be endorsing, Arnie, you're the cardiologist, but, for a while, these new updates were coming up, nuances to these protocols were coming up every 3 and 4 months. Somebody was putting a little twist on this and a little twist on that. And I think we should say physicians or their delegates should refer to the guidelines submitted by their professional organizations, i.e. AAP, AAFP, American College of Cardiology. Those things are one click away.
I agree with you, Al, and the physician should know how to access that. One thing I wonder is would it be, the only thing reason I think it'd be reasonable to, not that we necessarily endorse this, but more information, to have it accessible through the UIL website so that parents can actually see what and it probably would allow them to ask questions of their primary care provider a little bit better if they have some background information and know what is out there. Again, I don't think that we need to be in part of the process or implying that there's a certain process they have to go through. That's the physician, but should we provide this information to the families so that they know, my child had COVID, here's what I should expect.
So would you suggest putting up the one from the National Federation, the one that they sent to Mark?
I do. I think it would be, not that we are proposing that this needs to be, I think it'd be more informational.
Well, I think if we put it on our website, we are endorsing it. So I would, as far as you're concerned, is it a correct protocol?
I do. I think the protocol is a good one.
My question is, how often are they updating that protocol? As there's new information, if they're only meeting and updating it every 6 months or every 12 months, is that going to be staying as current as it needs to be?
Well, that's always the question. And as you know, there's been, everything has changed a lot from the first day of COVID to where we are now. As we gather more data, more information, and can better understand what we need to be doing. But
well, and Jamie and Susan, I think one of the things we could look at too is we do have a parent information manual that we put up on our website that includes a lot of information, including information on health and safety. We put a lot of information from the Federation in there. We could even look to maybe put a link to the Federation Sports Medicine Resources page where they have all their position statements and this type of updated information. The only thing we would have to work to make sure it stays current in that regard is the link itself. And then we have that information in there in our parent manual where they have a link to go find information from the Federation Sports Medicine Advisory Committee. If we feel like that's appropriate, that's one step that we could take.
Mark, do we have a similar access for physicians? You got a handbook for parents. I'm a general practitioner in Christoval, and I need to know something about this. Do we have a handbook or access for him to help find that information on topics that we deal with?
I don't think we've ever developed anything specifically for physicians that we posted on our website. They have access to all the information on our website. We have the health and safety page that includes all the information that we have, but my experience is we haven't done anything specifically for physicians for them to have availability, but just like any individual, they can access all the information that we have via our website on the health and safety page.
Okay.
I just think the form from the Federation that talks about the cardiopulmonary considerations for high school students, athletes during the COVID-19 pandemic. I can tell you that we see and we get a lot of calls from pediatricians who aren't comfortable deciding whether they can return to play from a cardiac standpoint. And this kind of information can help them to triage a little bit better on deciding who needs to see a cardiologist, who needs to get an EKG. So I'm in favor of the information and in favor of the information being available.
For what it's worth, as I mentioned at the top of the meeting, this is the number one topic we're receiving questions about. And what Arnie just said does touch one of those common questions. And that is, what am I supposed to do? That's what the doctors are telling the schools or the parents is, listen, I don't know what to do with you. Right. I get that they said, you got to come see me. I can say you don't have COVID, but I don't know what else I'm supposed to do. If I'm supposed to conduct an EKG, if I'm, now in my mind, it's never been UIL's business to tell a physician how to practice medicine either. And that's kind of been my response is, listen, there are potential post-COVID complications. UIL is not a medical research organization in any way. So we're not going to tell a physician how to practice medicine. But, Arnie, you just brought that up. So it does touch on that topic a little.
Well, I think that stepping back from what Arnie has said, and he agrees with this protocol, I think that we have to consider, is this going to set some sort of precedent? Because once we're through COVID, there's either going to be another infectious disease threat to the athletic population. Remember, we were talking about concussions in earnest about 3 years ago. And before that, it was about preseason screening using EKGs. So this is a general topic. What am I supposed to do is going to come up from general pediatricians. And I know the American Academy of Pediatrics, for example, just put out this great statement about post-COVID screening for the general practitioner. Arnie, I know you're familiar with it. It was one of your colleagues, was the lead author, who's up at the Mayo Clinic right now. Rich Friedman, I believe Rich Friedman's on it. I don't remember. But I read it and it's a great piece. So there is information out there that at least I know pediatricians in their journal should be able to access. Brian, it was Brian's, the first author was Brian.
Oh, Brian Cannon?
Brian Cannon was the first author, yeah.
Okay, I don't think I've seen that one.
It came out a month or two ago. It's really good.
Brian used to be a part of this group.
Yes.
Yeah, I did.
He was a member of our committee.
Yep. Anyway, getting back to Arnie's point is that I'm all in favor of information, but there's going to be one of these every 2 to 3 years. There's going to be a public health crisis, if you will, that may be unpredictable. And does this, if we put this information there, which I actually would vote in favor of it, does it set the precedent that we are in the business of almost endorsing the statement as opposed to all we're doing is information sharing? I think that's my perception of the decision we're making here.
Just as a side note too, don't forget that we are asking physicians to clear kids who they never saw to begin with, because I would say a majority of my kids, they did the kiosk tests. And even now with the advent of the at-home test that you can get at Walmart or Walgreens. So they are getting the positives. I'm doing the contact tracing. We're doing the isolations. Okay, this is your date to return. And now you have to go see a physician to get a release. So now they go to a random Care Now doctor who's like, I didn't see you to begin with, or the whole 10 days that you were out. And so now they are just releasing them back to participation. And they were never under their care to begin with.
Mark, you texted me. I think you should bring that item up too. Mark Chassé.
Mark
there,
is
Mark?
muted. He's muted.
Yeah, that's what they always say. Yeah, I mean, I think it's great to give this information, but just like when we talk a lot about some of these other heart conditions, I mean, most kids aren't in school. And so these physicians are still having to find references to get people, just back through, regardless of what they're doing sports.
Mark, what I heard you say is that most kids are not in sports, not just not in school. Most kids are not in sports. So they must be dealing with a lot of COVID questions that has nothing to do with whether or not my kid can play sports.
Correct.
Yeah. I mean, most of the kids are getting COVID or not trying out for varsity football or JV cheerleading. I mean, so they must be dealing with COVID.
Just a point I wanted to bring up.
Jamie, it seems to me like we need to come up with a motion on this issue. We've done a lot of discussion. I mean, let's bring this to an action step.
We're in the cardiac update portion. So I'll start by asking Dr. Fenrich if he has a specific motion.
Yeah, I mean, my motion is that I support the information that you sent from the National Federation of State and High School Associations, which I suspect the UIL is a member of, is that we just provide a link so that families, physicians can access this information more easily. And that it's informational. We're not endorsing anything necessarily.
Yeah, I think I would make and if I can add an addendum to that, I would make the information available for parents and, for parents and families. Making the information available for physicians implies that Arnie, I'm just reacting as an individual, is that it isn't available somewhere else. And the AAP, the AAFP, et cetera, they've all, American College of Cardiology, physicians need to be accessing that and providing this link for them.
Right.
I mean,
well, and when it comes right down to it, physicians can access the UIL website just as well as the parents can. So it'll be there and it'll be informational.
Yeah. So I would just provide it without qualifications of who can read it. We're simply providing what the National Federation has published as its recent guidelines, and anybody can read it who wants to.
And this I think will allow the UIL staff to be able to say, hey, there's our website has for additional information if you so want it or need it.
I do think some qualifier that Marion brought up earlier is that there may be periodic updates to this, whatever the language says, that these are not the 10 commandments when it comes to COVID and myocarditis.
Yeah, rapidly evolving.
Right. And I think most information that comes out about COVID qualifies it with in that manner, that this is constantly changing environment, and there may be subsequent updates that aren't necessarily included here.
Does the fact that we only have one site for the families to go to indirectly say that we are supportive of that site? In other words, are we giving it credibility on our stamp?
Yes.
Well, and also in our parent information manual now, we have a page, it's called Health and Safety Resources. It has a number of different links on there, and there's a heading on there that says these links provide information about a wide range of health and safety issues, opinions, perspectives, and conclusions expressed at any external websites are copyrighted by the relevant organization and are not expressed UIL policy. And we have a number of different links on there, some of them to the Federation information, some to National Athletic Trainers Association. We've got some links on there that go to the Texas Department of State Health Services. So there's a lot of information that we have in our health and safety resources section of our parent information manual that already has some type of a disclaimer on there. We could just add additional links to Federation information on there if that's what you felt was appropriate.
Mark, just give me a couple, 3 topics that are there. Probably concussion, drug use.
Parent's Guide to Concussion, how to avoid hyponatremia, cheerleader safety, cold weather illness, emergency medical procedures, information on staph infections, lightning safety, reducing head and neck injuries.
All right. So this is not precedent setting.
No, sir.
And that would be a perfect place to put this, I think.
Yeah, Jess found it and put it up, put a link to it on the screen now.
Yeah. Yeah, I mean, this just makes my point earlier. For the 20 years we've been having this committee meeting, there's always been a sort of crisis du jour, MRSA, cold weather, concussion, sudden death, et cetera. So I think in that context, I would support Arnie's sharing this information. It is troublesome, though, that we're 18 months into this and physicians are still calling the UIL and saying, what am I supposed to do? Or whomever they're calling. It just, I mean, rather than being a criticism, it's just troublesome because there's been a lot of advice rendered on this.
So let's have a motion to add this to the health and safety resources.
I motion that we add a link to the health and safety resources that allows parents and athletes to access the National Federation of State and High School Associations information on COVID-19 considerations.
I second the motion.
All in favor?
Aye.
Aye.
Any opposed? Okay. Next, Jamie.
We'll review the medical forms to see if there's any changes you guys would like to see to those.
Can you share that just so we know what we're looking at?
Yeah, I think Jess is probably working on it. The PPE form, Jess, is probably the first one we really need to look at.
Jess, can you, thank you.
Is that good, or would you guys like it bigger?
I can read it.
Okay.
Yeah, and I think y'all see the changes that we talked about at the last meeting, I think have been added into. There was an update to under question number 3 from the last meeting in reference to the died of unexplained death before age 50. And then under the male only section, there was that update there under question number 20. And then the actual physical examination form itself on the next page, there was an update on the male examination as well on the actual physical form itself. If you go to the next page, Jess. Yeah, under the males only if indicated. Those were the changes that were talked about last time that are on the form currently. So now we'll be discussing if there's anything else that need to be done going forward. These were all the updates that were made at last September's meeting that are on the form currently being utilized.
So this probably goes back to the comments by Dr. Fenrich and Dr. Hergen wrote earlier in the meeting, the mental health related questions, whether or not they should be added, and the COVID related questions.
And my question on this is we spoke a lot about COVID, which it is what we're dealing with now, like we did years ago with H1N1 and so on and so forth. Is Is that something we want to consider adding as a question? Have you ever had COVID, and then leave it at that and let the physician take it from there? Or do we want to leave that separately? Because we don't ask about a lot of diseases on here. And I didn't know if that was something that we wanted to talk about or have on there, or what's your opinions on that?
I don't think I'd add COVID to this form. I will tell you that I reviewed some of the other states, and some of them have a whole page that they're asking questions about COVID. When did you have COVID? How long did you have a fever? Did you have any of these symptoms? Do you still have any of these symptoms? So I know there are other states that have are using forms like that, but I would not add COVID to this form, or the question of have you had COVID? And
It
I
already
agree.
asks if you have a medical illness on there. I mean, that's a yes
Correct.
or no, right?
Yeah, and in terms of the cardiac complications of COVID, these 14 questions here should uncover
Clearly.
some
Yeah,
of
clearly.
those cardiac.
Yeah, it would, because it's some of the questions are designed to ensure that they don't have or haven't had myocarditis, which is what you're worried about post-COVID with more severe illnesses of COVID.
I agree with everything y'all said. I just wanted to throw that out there because I know we're going to get asked.
Yeah. So I'd be in favor of not adding that question. And the reality of it is now is the ISDs are not screening for COVID the way they were back in 2020. And there's kids who are getting infected with COVID that we're not even detecting.
Yes.
All these kids are back in school. I mean, it's just, that's not rocket science.
We do have a recent virus question already in there, even though that was geared more towards, the myocarditis and the mononucleosis. I mean, it's already there in question
there we go.
3.
Yep.
We already have that question. The only consideration is, should we have listed myocarditis, mononucleosis? Should we consider adding, for example, COVID?
I think that question would be inclusive of the COVID myocarditis.
Yep.
Agree.
Yeah, because, what's the next? Then we don't have to update it for the next virus that comes through.
Exactly. And there's a lot of other viruses that cause myocarditis besides COVID.
Sure, yeah. And I agree. And I also agree, I wouldn't add those questions about the psychiatric depression and anxiety questions either.
I totally agree with that.
Yeah.
Same here.
And I can promise y'all won't upset us if y'all make no changes to the physical forms. That will not hurt our feelings at all.
It won't hurt my feelings.
Can I ask, are we being asked to add or take anything off of this form, or is it just for us to comment on?
To my knowledge, we're not being asked to make any changes at this time. I was just throwing that out for discussion.
Now, this is just our routine review of the form.
Yeah. So Dr. Fenrich, I would say this, there are those who are asking, what are you going to do with your pre-participation physical, given the COVID context? But I'm personally comfortable answering those questions that you guys have discussed this thoroughly. Feel like, there's these dichotomies that we get into regularly about, and they were mentioned earlier, are we in the business of public health, or are we in the business of making sure as best we can, students can safely participate in our activities? And there's a big difference in the two. And this committee historically has landed on, we're not in the public health business, nor are we in the business of telling physicians how to practice. And so, you guys have discussed this, feel like the COVID related issues are appropriately addressed with the existing questions, and fully recognize that physicians who are conducting these PPEs have the authority to ask different things as they're conducting those physicals. So I'm comfortable with no changes if that's where you guys are. Which doesn't mean we're not getting asked about how we're going to respond, but I'm not aware of any specific request to add something.
I think this is a good form. I think we should stay with it.
I agree.
I think I make the motion that we make no changes this form.
I'll second.
Anybody opposed? Okay.
I apologize if you see any animated emojis like explosive fireworks effects in the background of any of the UIL staff members' screens, given that there were no changes made to the form. Mark, NFHS SMAC update. We've talked a lot about it already, but what would you add?
You see the agenda on there. They're meeting next month, October 2nd through the 4th. A lot of the same things, obviously, that we're looking at. COVID-19 updates, mental health updates, work on that. Every meeting that they meet 2 times a year. They look at their position statements and guidelines. They're looking at the ones in reference to hydration, heat illness prevention, skin infections, and hygiene, those types of things. So we may be looking for some new information coming out on those. But again, that's not necessarily something that we share widely with our staff, with our schools. But again, through our parent information manual, we do link to a lot of that stuff. So we'll be working to make sure that we have all that stuff up to date and current. But just a general update, they deal with a lot of the same issues that we do, just on a 50-state basis rather than a 1-state basis. Plus DC.
And Jess, if we have any information to share on the injury update related to any catastrophic injuries that were reported to us or AED intervention use.
We don't have any to provide. We did have one student last month that we are trying to collect some information on, but they haven't submitted a form yet. It was a cross-country runner that was hit by a car.
And we did have a couple of issues last school year that we're still working to gather additional information on. We had a football player from that had an issue in practice of a potential heat issue, but we're still gathering some data on that and looking for a report from the school. And then we actually, last football season, during a football game, had an official collapse and be revived by an AED. So we're still working to get some of that information reported as well. Because with our new rule now, the schools are required to report those kinds of things. And so we're just going back and reminding those schools that that needs to occur. So we'll continue to gather information on those like we always do. And once we have an opportunity to gather that additional data, we'll certainly share that with the committee.
That AED intervention use that Mark mentioned is a great news story. It's absent that AED intervention, we would have lost an official, and we did not lose anybody in that event because they responded appropriately and quickly using the AED. It's a really pretty touching story.
Yeah, the interesting thing about that one is that was played at a site that wasn't the home school of either one of the schools because they wanted to play at a larger facility so they could have some of the social distancing. It was actually the visiting team that had an AED on their sideline that was able to get that to them. They ultimately found more than one AED, which I think is awesome, but it was actually the visiting team that had one on their sideline that was able to get it out there first.
That's really great information to disseminate so that, because I think that just is a strong support of AED being present everywhere, really.
Well, it is. It's an affirmation of our support from way back when with Senate Bill 7 when this all happened.
Just not want to toot the horn of the medical advisory committee or anything like that, but this group passed a requirement for all of our high schools to have an AED before Senate Bill 7 ever got passed. So just another pat on the back for the work this committee does.
And do we have any subcommittee reports? I'm not aware of any, but if there are some, happy to hear them.
I do not have one.
No additional cardiac.
And I wish I could do this more appropriately, but I don't have the story in front of me. I do believe we have a medical advisory committee member who was in a really great news announcement. Dr. Chassé, I don't mean to put you on the spot, but it was a big deal. If you want to tell us about that.
Yes, I'll be changing employers, or I have over the last couple of weeks. I'll be the new chief medical officer at Blue Cross Blue Shield of Texas. So working through our folks on that on compliance issues, but haven't heard any issues from that standpoint since it's a non-paid position. But in talking with some folks, would like to continue here if that's the will of the folks, and I think it's a good way for us to have a good idea of what's going on with the population that's doing athletics.
Congratulations.
Congratulations. And
Congratulations,
when,
Mark.
when Mark called me, I encouraged him to stay on our committee because I think both parties, him, Blue Cross, and us, will all benefit from him continuing his service here.
Absolutely.
I also want to know, can he get me a discount?
I knew that was coming. Oh, Mark.
I think you're too high a risk.
Actually,
Mr.
now we
Chair?
know who to talk to when we need to get a prior auth through.
Yeah.
Stay tuned.
Mr. Chair, that gets us through the agenda.
Anybody have any other issues?
I do have one question for UAL staff. Our decision on the physician and or his delegate to clear for COVID, when can that be announced, and when can our people in UAL know? Because that is a pressing question.
This week and possibly tomorrow.
Okay, that'd be perfect, because just in this last week, I've had at least 5 phone calls.
I'm getting 5 a day, so no one is more
Okay, you got me beat.
incentivized to get this information out than me, I promise.
I've been sitting on about 5 emails or 6 emails waiting to answer until next week, because I was hoping I would have information to send out. They think I haven't just ignored them. I've just been waiting so I'd have additional information to send out. I probably should have told them that.
Well, you do ignore them because you ignore me all the time.
I probably get 2 a week, but I've simply told them that the physician is ultimately responsible, and whoever he gives the ability to do the evaluation, it's his responsibility. And so I think we've got it covered now.
Hopefully this will help us have to answer that. That's the answer we've been giving as well. Hopefully this will, help us have to answer that less.
I have a question for UIL staff as well. On our COVID mitigation, the guidelines that you guys have on there that was put out in August, can I get clarification on actually 2 of them? On the one where we're supposed to do that report every Monday, is that separate from what the districts are doing? Is it UIL specific? Because the districts are already doing something on that same platform for all Gen Pop positives. So now that it's on UIL, was that supposed to be separate? Was it supposed to be UIL venue separate?
No, all that it says in the UIL piece is that you have to follow that reporting requirement by the Texas Education Agency. There's not a different reporting requirement for us.
Okay, so basically touching on that same thing, the same thing with the letters going out for a COVID positive. If the district is doing something where like everybody who was exposed or whatever in the classroom is getting that letter, it didn't necessarily mean just because I have one in soccer that a separate UIL specific, athletic specific letter has to go out?
No, just that you're following the same exact requirement that TEA has in terms of, close contact notifications.
Okay, that's what I needed. Thank you.
There are no more questions. I'll entertain a motion to adjourn.
When is our next meeting?
Before we adjourn, if we want to have the April meeting, we can either do it on the 3rd or the 10th.
In person or Zoom?
I was gonna congratulate the staff about this Zoom format. I think this really works.
Yep.
Did we pick a date?
I'm looking at my calendar.
Either date's good with me.
You said the 3rd or the 10th?
Yeah.
Yes, the 17th is Easter.
Either date works for me also.
Anybody,
I'd aim for the
anybody have one
3rd.
they,
I would, either date works, but I'd prefer the 3rd.
I'll
Yeah,
go with
I
the
agree
third.
too. I think AMSSM annual meeting is actually in Austin on the 10th. Is that right, Al?
I
So
don't
I
know the
prefer,
date, but it is in Austin, yeah.
yeah.
I'll entertain a motion for the 3rd.
I second the motion.
I'm good.
Anybody
I'm good.
opposed? All right.
We greatly appreciate your service. We know how busy you guys are. Dr. T, we hope you get feeling better.
Up to two.
There was a bit of a feline theme to the meeting. There was a couple of cat sightings.
But nobody was a cat.
At least it wasn't a black cat.
Right.
My cat doesn't like me, so she wouldn't even come in the room.
Smart cat.
All right, guys. Thank you.
All
Thank
right.
you.
Thank you.
Thank you.
Great job
everyone.
today.